Hello class, today's topic is comfort and pain management. Our student learning objectives include elements of pain, comparing and contrasting acute and chronic pain, obtaining a pain assessment, explaining the relationship between pain and other human functions, utilizing holistic approach or non-pharmacological interventions versus pharmacological interventions, collaborating with an interprofessional team or interdisciplinary team to manage pain, and using teaching and counseling skills to empower the patient to direct their own pain management. Objective 1. Describe elements of the pain experience, page 1335 to 1340. So pain is whatever and wherever the person states it is. Pain is a personal account that should be respected. Pain can be learned through life experiences, and it is a subjective experience. So subjective meaning it's whatever the person says versus objective, which are facts that you have assessed, such as the numbers for the actual pulse rate, respiration rate, blood pressure rate. Pain cannot be presumed because of activity in the sensory neuron. So, what brings one person pain may not bring another person pain. So, pressure on someone's shoulder could be a pain trigger for one person, when another person it could be just fine or it could actually be pleasure. Pain may have an impact on the whole person. Verbalization of pain is only one way to communicate pain. The inability to communicate does not mean the person is not in pain. So you must use a nonverbal pain scale to assess pain for someone that cannot communicate the pain to you, whether it's cognitive impairment or whether it is the lack of whether it is aphasia where they cannot speak or they're unable to just verbalize their thoughts. Compare and contrast acute and chronic pain. This is objective number 2, page 1342 to 1344. Nociceptive and acute pain usually has a rapid onset and is a warning of some type of tissue damage or disease. It also signals an autonomic response, such as a fight or flight. So if you touch something hot, you automatically a reflex is to pull back from that stimulus, right? So that's your flight or fight response. Increase in blood pressure can occur, increase in heart rate can occur. After the underlying cause is resolved, then the pain will cease. So this is acute pain. Pain that exists for 3 months or longer is considered chronic pain. It can have periods of remission and exacerbation. Nociplastic pain is chronic pain that is a primary source of pain. Neuropathic pain is described as burning, tingling, electric, or stabbing pain. Disorders of the periphery or central somatic sensory nervous system is considered neuropathic pain. Objective number 3, identify factors that affect a person's pain experience, page 1345 to 1346. Factors affecting pain include developmental and genetic factors, social factors. Social factors are cultural, situational, and adaptive factors. So, how well a person can adapt to the pain or the change that the pain may be causing. So, persons having leg pain, they may not be able to ambulate or ambulate as long as they normally would, or stand or transfer independently, right? Psychological influence, personality, coping skills, health, mental health, anxiety, other stressors such as depression. It could be financial constraints and past experience. So all these are factors into the person's pain experience. Environmental, which includes their support system. So whether a person has a support system, how is pain perceived in their environment in which they live and have been raised, where some people may or families may be more stoic and don't show their emotions, or maybe not show them in public. Others may be more vulnerable, where they are freely expressing their emotions and they are um, okay with experiencing pain out loud in public and in private. Religious beliefs. So some may believe that pain is a result of them not being good or not having enough goodness in them, not living righteous, or whatever their beliefs are. Sometimes some religious beliefs are that pain is a punishment for their sins. Obtaining a complete pain assessment using appropriate interviewing and assessment skills. Page 1359 to 1354. I also have table 36-3, which is on 1352. It has a variety of different pain scales that can be used depending upon the person's ability. So pain is the fifth vital sign. We've spoke about pain in lab, so you guys should be somewhat familiar with pain. It is the fifth vital sign, meaning when you take your vital signs, you have to ask your patient about pain. When assessing pain, the patient verbalizes the description if possible. If they are nonverbal, you have to use a nonverbal pain scale. Okay? So the description includes duration, location, quality, or characteristics of the pain, intensity, anything that aggravates the pain or causative factors, what relieves the pain, what makes the pain worse, other factors that may impact the pain, such as anxiety or depression. So, stress can cause pain, effects on function, sleep, quality of life, and ultimately what is their management goal. So management goal for some may be 0, no pain at all. Management goal for others could be 1 or 2 or 3 on the pain scale, right? So the management goal is whatever your patient verbalizes their pain tolerance is. In your pain assessment, always include provoked, P R P PQRST, provoked. So what causes the pain? What makes it better? What makes it worse? So provoked or palliative, P. Q, quality. So describe the pain. Is it sharp? Is it stabbing? Is it dull? Is it electrifying? Is it tingling? Is it numb? Radiating. So does your pain radiate? And if it does not radiate, then indicate the source, the location of the pain. So the pain is in my right lower extremity, it does not radiate. The pain is in my left shoulder and it radiates down my left arm. Severity. So you want to use some type of pain scale to determine the severity of the pain. So the pain can be a numeric scale, which is most commonly used. It could be Wams-Baker's, the smiley faces. That's often used for children and sometimes the those with a mild cognitive impairment that's able to still verbalize how they feel. Or you can ask about whether they consider it to be mild, moderate, or severe pain. Okay. Oftentimes, our elder adults, if they're unable to put a number to it, they're able to tell you mild, moderate, or severe. And the timing. So, is the pain continuous throughout the day? Is it intermittent or is it transient? Okay. So transit means that it's intermittent pain that occurs and comes and it goes, right? Objective 5, explain the relationship between pain and other areas of human function. So, acute pain may affect a person's vital signs, such as respiratory rate, blood pressure, and heart rate. For older adults, pain may impact their mood, their ability to function or do their ADLs. Their sleep patterns may be disturbed, weight gain or loss, cognitive changes as well. Chronic pain may change a person's mood, mobility, ADL, sleep, weight, cognitive status, depression, anxiety, and social isolation. If a person is having difficulty coping with pain, they may verbalize this difficulty due to stress or pressure, and they may refuse pain management interventions or decline physically. Objective number 6, page 1356 to 1362. So we're going to talk about utilizing holistic approaches to pain management, considering multimodal approaches for both pharmaceutical management of pain as well as non-pharmaceutical management of pain. So non-pharmaceutical is just anything that does not involve medication. So complementary health approach, CAH, or integrative care, IH, are both non-pharmacological approaches to pain. So some examples of CAH and IH include using distraction, employing humor, listening to music, using imagery. So that's just having them think of good thoughts, maybe a happy place, being on the beach, and thinking of something that brings them pleasure, playing with the grandkids, mindfulness, cutaneous stimulation, which includes massage, acupuncture, biofeedback, transcutaneous electrical nerve stimulation or TENS, electrical muscle stimulation or EMS, also known as ESTEM, applying heat or cold or both to the skin. So this is any way that you stimulate the actual skin. Okay. Hypnosis, healing, therapeutic touch. In this particular healing therapeutic touch, the patient is actually not touched. So you are just transferring energy. So I know Mainline Hospital does have nurses that's certified in holistic care, and they are called consulted rather for this therapeutic healing therapeutic touch, where they actually just kind of put their hands over top of a person, they dim the lights, they give them a nice serene, and then they just basically transfer energy to the patient. And patients have said that it does help and it does work. Managing pharmacological relief measures. So, also, of course, you can give pain medication, right? Okay, this is pain medication is not CAF or IH. This is another method, a pharmacological method. Okay, and I have 1356 to 1362 written there. Establishing a trusting relationship with your patient is essential to provide effective pain management. So your patient must believe that you have their best interests at heart, right? So you want to initiate both non-pharmacological and pharmacological interventions to manage their pain. Your patient should be a partner in the development of that plan of care to manage their pain, and building this trusting relationship is essential to developing that plan of care. Objective 7. Collaborate with interprofessional team to develop, implement, and evaluate effective, individualized, evidence-based pain management regimens. Page number 1354 to 1356. Nurses, providers, and other healthcare team members may collaborate to develop a plan to manage pain. There are also pain management centers that can assist with managing chronic pain. And for pain at the end of life, the hospice team is a great resource if, in fact, this person is on hospice. The team, which consists of nurse to provider, social worker, oftentimes are able to come to a nice pain management plan of care. Never attempt to manage pain before assessing the patient's pain. So the pain assessment must be completed prior to you attempting to manage the pain. Otherwise, the pain will be masked and your pain assessment will be inaccurate. Objective 8, using teaching and counseling skills to empower patients to direct their own pain management programs. Page 1373, 1374. Patient teaching decrease anxiety and helps with pain relief or management. Teaching about pain is both for the patient as well as anyone they identify as significant in their care. So it could be the wife or some other loved one. Teach your patient the following concepts. So safety is one. And for safety, no driving or operating heavy machinery when taking medication, pain medication, because it can then alter the patient's um, a response time, alertness, and cognitive ability, depending upon the type of pain medication. Avoid use of alcohol. It will only intensify the pain medication, the effects of the pain medication. Do not smoke alone when taking the pain medication because the patient may fall asleep and you don't want the person to fall asleep while they're smoking or have a lit cigarette in their hand. Get assistance if needed with walking, ADLs, or any other type of activity if you realize that the pain medication is causing an impairment where you cannot physically do things that you would normally be able to do. Um, you want to make sure you ask for assistance and keep a pain diary so that you may realize that the pain only occurs at nighttime when you're laying in the bed. If pain only occurs in the morning when you first wake up, or maybe it only occurs when you stoop or bend down. So keep a pain diary. And you want to note like the consistency of the actual description of the pain as well in that diary. So diet. Do not take pain medication on an empty stomach. Oftentimes the pain medication can cause irritant to your stomach, as well as you want to just have something on your stomach just to prevent those side effects such as nausea. Some of these pain medications can be a little rough. And if you are breastfeeding, please talk to your provider before breastfeeding while using pain medication. Okay, so you want to make sure that it's safe for the baby if in fact it crosses over into the breast milk. Thank you for your attention. Any questions?